Hi, this is a video kind of going over what I've learned from my prophylactic or preventative mastectomy. It's not meant to be medical advice by any means. It's just kind of my personal experience with the whole procedure. So, first of all, what is a prophylactic or preventative mastectomy? It's whenever you get removal of your breast, usually bilateral, so both of them, when you have probably a high risk of cancer or for another reason. So, you don't have cancer, but you want your breast removed, usually to lower your risk of breast cancer. So, a little background. In my family, we have quite a bit of breast cancer. I've had several breast biopsies. So, the normal lifetime risk for breast cancer is about 18%, and mine is about 53. So, really big increase in what the average is. And then, like I said, I've had a lot of biopsies, and I have three different atypical cells in my breast. So I have a lobular carcinoma in situ, and carcinoma we always think about it as cancer, but this is not actually cancer. It's kind of like a precursor, or some people consider it like a pre-cancer. So they're just abnormal cells, but it greatly increases your risk of cancer. I have atypical ductal hyperplasia and flat epithelial atypia. Again, these are abnormal cells. They're not cancer. They're early signs of cancer, and oftentimes, or sometimes, they can develop into ductal carcinoma in situ, which is the first stage of breast cancer. And then I have one more. It's called PASH. So it's a really strange name. It's pseudoangiomatosis, stromal hyperplasia. And again, these are just more atypical cells in the breast. They don't really know what causes it. Some of these can be linked to hormones. Some of them can just be weird abnormalities within your body. But again, none of these were actually breast cancer, but they greatly increased my risk of breast cancer along with my family history. So that's why I chose to get a preventative or prophylactic mastectomy. So again, I'm going to kind of share what my experience has been. So hopefully it can help you if you're considering it. I do not regret the decision. I'm 3 weeks post-op now. And I will say it has not been easy, but I feel like it's easier than dealing with cancer and going through chemo and radiation and all the terrible things that does to your body, and how strong you have to be to go through that experience. So I'm really grateful that I've had this opportunity to receive this surgery, so it will hopefully extend my life and I never have to go through that. Also, side note, whenever you get a preventative or prophylactic mastectomy, especially if they remove the nipples and all the tissue, right, you only have like a 2 to 3% chance of breast cancer. So I went from about 53% to 2 to 3%, which is very awesome. I will say one of the first things I kind of dealt with, besides feeling grateful that I could have the surgery and not have to go through what a lot of my family members have gone through. My aunt unfortunately passed this summer from breast cancer, and she fought really long and hard. And one of our second to last conversation actually was her telling me to get the surgery. So I feel really confident in the decision, and that was the right decision. And I believe if she had been given that opportunity, that it would have changed her life, the outcome of her death. So again, I'm really grateful to have gotten the surgery. But also I feel like when you get a prophylactic mastectomy, you kind of have some imposter syndrome, because after the surgery, you're going through the pain just like anyone else who's had cancer goes through the pain. You're going through the process, you're going through everything, but you feel kind of guilt sometimes for having negative feelings or complaining, because honestly, it's a blessing to be able to get the surgery and not have to have cancer like many women and some men go through, because that's traumatic and that's hard. So you will probably deal with, or I dealt with, some like imposter feelings, like feeling guilty for having my feelings that I had after surgery. One of the biggest things that I feel like looking back helped me was preparing. So working out before the surgery, trying to maintain as much muscle mass as I can, trying to get lots of protein, trying to get lots of rest. Also preparing psychologically. If you can set up counseling, if you can set up like psychiatric care, if you have any unresolved or untreated depression, anxiety, anything like that, getting that taken care of probably like 3 to 6 months before definitely helped me to feel more comfortable and probably respond better to all the stressors that were going on within like my brain and my body. Um, Also, big thing is finding a caretaker. So for the first 2 weeks, I definitely needed someone to take care of me almost around the clock. That person would set a timer and give me my pain meds like every 6 hours, every 4 to 6 hours, because the first 3 to 4 days you will have a little bit of pain, maybe a lot. I didn't have a significant amount only because I believe I was taking my pain med every 4 hours. So, and you want to have lower amounts of pain, obviously, not only for your comfort, but for healing. Um, so my mom came and took care of me for the first 2 weeks. My husband took care of my kids, took care of the pets, so I didn't have to worry about any of that. Lowering the amounts of stress and the amount of things you have to do is really, really, really important, or it was definitely imperative for me because that allowed me to just rest and try to get better. The first week, honestly, I didn't have that much pain. It was hard getting out of bed, things like that, but it wasn't terrible. It really wasn't. The hardest thing for during that first week was whenever I took off my dressings, off my ACE wrap, and looked in the mirror, because you no longer have breasts. Even if they insert tissue expanders, you really don't have breasts, and it kind of gives you a nauseated feeling looking in the mirror. You feel like you've been kind of mutilated. Even though, again, I was grateful to have the surgery. I wanted the surgery. It was my choice. That was kind of a shocking feeling I had because it left me with a little bit of uncomfortable feelings looking at myself in the mirror. It was just awkward. And then when the drains, I had 4 drains, which I believe 2 to 4 is average. And the drains coming out of your body, even though as somebody who works in the health field, I've dealt with a lot of patients with drains. It was still kind of an odd feeling and a little bit of discomfort seeing that coming out of your body. And they are uncomfortable. They really are. You have to sit upright for at least the first 2 weeks to sleep. And they kind of tug and pull and they kind of snake around in the chest area, and you can kind of see them underneath, and it's kind of off-putting. So I wish I had prepared a little bit more mentally for that. That would have been helpful. But that feeling goes away. That feeling gets better and better each time you acknowledge that if you want your body to remain like this, that's fine too. But if you are having reconstructive surgery in the future, your body will not always look like this. And then again, having my husband help out with my kids and my pets was a huge blessing. Having him pretty much take care of them around the clock, where my mom was able to take care of me, was really important. Also, reaching out to your friends, family, anyone you know and love who can support you through this. If you have faith, if you're religious, I would recommend reaching out to your church and having them pray for you, because I believe that prayer definitely helps. I believe that's why I've responded so well to the procedure. They actually have studies, and honestly, they have studies that kind of show lots of different things, whatever you're looking for, but they have lots of studies that show that if you have any sort of faith, any sort of kind of like religious beliefs, that you cope better. And if you're coping better, then you usually recover better. You're able to adapt better. But I will say that about the second week of surgery, even though I had read lots and kind of prepared for the fact that I may have some emotional challenges that week, about the second week, beginning of the second week, is when I started to feel really depressed. You kind of start doubting if you're gonna feel better. You kind of have some dissatisfaction with where you're at physically, because you're still not able to do really much anything. So that week, it was about probably at least 3 to 6 days of that week that I felt really, really, really down. And I honestly thought that I wasn't going to experience that, because I've always thought I was pretty strong. But this has been a very humbling experience, realizing that maybe I'm not as strong as I thought, and maybe I need to rely on others and pray more and rely on God. So that was a very humbling experience. And you still don't feel very good, so you're kind of cranky. And I don't like that cranky feeling. So I feel like that's just kind of a tough time for everyone during that second week. So that's something to maybe kind of anticipate. And again, that's why I say, like, I tried to get my psychological health under control before that experience to hopefully alleviate a lot of that. Also, another thing is to think about finances. So, insurance covered my surgery, and it will cover for a lot of people who are high risk. Sometimes your doctor has to submit the claim multiple times to get it approved. Thankfully, mine only had to submit once, which was really, really nice. But depending on what insurance you have, you still have to pay for the surgery. So there's still like a catastrophic surgery cap, and ours was like $4,500. So again, thankfully, I didn't have to pay the full amount of all the surgery because that would have been very, very expensive. But just mentally prepare and financially prepare for the time that you need to have off from work, and also the cost of surgery. I thought at like 2 weeks, again, because I don't have cancer, I'm pretty strong. I'm maybe a little younger than some people who have mastectomies, that I would be able to go back to work a little bit by the second week or after the second week, but that is not the case. I do feel a lot better this third week, but I still feel really tired a lot. So again, a realistic expectation is very important. So also, I wanted to go over one more thing, and that was what my surgery entailed. Because you can have different procedures. So I had a bilateral mastectomy, meaning they remove all the breasts, they remove the nipples, and then they place tissue expanders. So tissue expanders are these little plasticky like things that they can inflate with, I believe, saline or air. I've read two different things. To expand them to essentially expand the tissue, expand where your breast is going to be, form a capsule that an implant can be inserted into. So that can be above the muscle or below your pectoral muscle. So that's another thing to consider in recovery. If they place that expander below your pectoral muscle, it looks better in the long run. It makes your breast look more natural in the long run because you have that muscle covering it. But they tear it away from your chest wall. So that's definitely uncomfortable. So even after I got my drains removed at 2 weeks, I had a lot of, like, I think muscle spasms or the like popping of the tissue expander, which was really uncomfortable and very annoying for like 3 days. Also, when you get your drains, you'll probably have them from 7 to 10 days is what a lot of people have them. But if you have any mesh implanted like I did, biologic mesh, then most surgeons recommend at least 2 weeks. And some people I've heard, one of my friends had hers for, I think, 28 days or something close to that. It just depends on how much fluid your drains are putting out. They want it to be under 30 mils, or at least my doctor wanted it to be under 30 mils within each day to have it removed. Let's see here, one more thing. Oh, also make sure you're researching your doctors. Make sure you find a good doctor, not only with good reviews, but also one that's like compassionate towards you and responsive. Because again, during these surgeries, it causes a lot of anxiety. So if a doctor doesn't seem like they are receptive to your concerns or responsive, then it's concerning and it just adds more stress. Another thing I didn't know before all of this is that if you are seeking reconstruction, you'll have two doctors, two surgeons, okay? So you'll have your mastectomy doctor, and they submit to insurance for approval for the procedure, right? And that's the doctor who removes your breast tissue. And then usually at the same surgery, you'll have your reconstructive doctor, not always, but you'll have your reconstructive doctor that's working after they remove the initial breast. They can like start working with tissue expanders, or sometimes some people can actually get implants or whatever other option they're choosing for reconstruction at that time. It's not always possible, but sometimes it is. I had to have, I will have to have multiple surgeries. So removal of the breast with tissue expanders placed, which is honestly very common, and then another one for implants. And your options for reconstruction, as far as I know, or my options for reconstruction were tissue expanders and then implants later, and you can choose saline or silicone. Silicone gives usually a more natural look. Saline, from what my doctor told me, has more rippling, so it doesn't really look as natural as a natural breast. Another option I was really interested in but wasn't a candidate for was the autologous fat transfer or fat graft. So they take fat from another part of your body and they build breast tissue with it, which is pretty amazing. So it looks more natural as a breast, but usually you have to have multiple procedures to do that because they can only put a certain amount, I believe maybe 100 mils, I'm not certain, of fat transferred from another part of your body, usually your tummy, sometimes your hips, sometimes your bottom, into the breast at a time. So it's usually multiple reconstructive surgeries. And the big negative with that, if you are eligible for that procedure, number one, you have to have enough fat tissue that your doctor feels comfortable taking. But the main negative I saw when I researched was that you can have fat necrosis, which sounds scary, but it's not as serious, according to what I read, as most people think. It kind of, I believe, encapsulates. Sometimes it can give like a rippling effect of the breast. And fat, the bonus of having a fat transfer is that it's natural, right? So your body won't reject it. But also that the fat cells can multiply. So if you gain weight, your breast will get larger. If you lose weight, your breast will get smaller, typically. But with implants, it's going to stay that one size forever. You're not eligible to gain more breast tissue. That's never going to come back, or more fat in that area now that they've removed it. So hopefully this has helped some of you guys. My experience has helped some of you guys kind of understand the process. But again, it's not meant to be medical advice. It's only based on what my experience has been, and hopefully it might help you. Oh, also one more thing I wanted to share. Even though I don't have cancer, I haven't gone through chemo. One of the things that did shock me out of surgery was that I was losing a ton of hair. I mean, I still have quite a bit of hair, thankfully, and I'm not trying to complain, but after surgery, I would lose like tons and tons of hair. I'm still losing it, but I believe that's just because of the stress, the physical stress that the surgery had on my body. And on that note, make sure you're drinking enough protein. This is the only protein drink I've ever liked, and you may or may not feel like eating, honestly, after surgery. I've had a decreased appetite, and so this isn't a ton to drink, but it has 30 grams of protein. So make sure you're getting tons of protein throughout the day. Or I'm trying to make sure I'm getting more protein throughout the day, and this is an easier way to do it. It does have sucralose in it, which is Splenda, so it's fake sugar, but I'm not going to be making food, and I want to make sure I get my protein, so it seemed like kind of a good option. Again, if you're considering a prophylactic or preventative mastectomy, make sure you do your research, take your time, don't rush it. And try to prepare as best you can. You will come up with challenges. You will have days that you maybe doubt your decision or you doubt your strength. But know that honestly, that's normal. That's part of it. That's part of the healing. That's part of the process. So thanks for watching, and hopefully this helps.